Good evening, my beloved colleagues today. Very, very good wishes for all of you who already joined in time and thankful to you. Can I get help from anyone, please? Is my voice clear? Can you hear my voice? Anyone? First,
Yes, sir.
Nasir. Oh, thank you. And the screen is visible?
Yes.
Okay, okay. Thank you very much. Thank you very much. So we can go to the session now directly. My humble introduction with you, and hope that all of you are in your good health. This is our name of the institute. And our assigned topic today is the preparation of AKT exam. Some of you definitely appearing in the exam in coming diet. Some may not. Even then, we need to be prepared. If we can take a long time for preparation, this is best. Anyway, uh, there may be some different techniques adopted by the different candidates or advised by different mentors as well. But what we feel better for our colleagues, we will try our best to discuss with you, interact with you. And what we will discuss mainly today here is the utilization of the learning materials. All our learning materials we are having, but for the exam purpose, what will be the learning materials and how to utilize it? This is one of the target of today's discussion. Another is, what is the technique of studying single best answer format? Because this is the format for your AKT exam. I like to repeat the word, how to study. Okay. Second, the third point, how to attempt mock question. So there are a little different techniques. Studying question or learning bundles or learning materials. Another is attempting the mock question. So in three major headlines, our plan today. So let's go on. A lot of foods in front of you. For example, if you are invited somewhere else, many things are given. What will you choose? If somebody don't mind, can you tell what will you choose from here? If you are given to take right now, don't be puzzled. Dr. Ashraf, you are shown in the first in the list. What will you choose?
Uh, Burger, sir.
Burger. Thank you. Any other one to choose? Anything? Please quickly, yeah. Try to be interactive. So you might be puzzled because most of you will be puzzled really, but Dr. Ashraf is very nice to choose directly something from one from there. Because almost all the foods are very tasty and all of you possibly like to have anyone or more than one. So if you have a lot of materials for your learning, opportunities rather, not only materials, opportunities also, sometime it might be puzzling for you what to be started with first, what will be suitable for you. So like these, actually, we like to talk today. So these may be your learning materials with you, textbooks, lecture videos, many notes, recall sessions, question bundles, mock exams. There might be some other thing also technically. What we do in our academic, suppose institutional study in our schools, in our college, Definitely we are having textbooks, some notes and modules, many things. But our target today is exam preparation, remember it, and we will highlight this only, not our institutional learning. So from the learning materials, what will be the good materials and how to start with, and to which learning material we have to give more importance depending upon the time remaining in your hand. For example, in the coming diet, time is not too much in your hand. So those who are appearing the exam, you need to utilize best of your time. You are doing your job, you are busy with your family and other members, but side by side, you are appearing an exam as well. So combining this thing, it might be a challenging for you. So keeping in the mind, the remaining, how many days remaining for exam? Can anyone calculate and tell me? AKT exam in the coming near about maybe in the November, right? So 3 months, near about 3 months. So is very rather to say minimum time rather to say for preparation, no doubt, no doubt. But some doctors is to be hurried for many other reason. Even less than 3 months time also someone is to appear the exam. This is exceptional thing, exceptional thing. So with this few introduction, we just start talk with the textbook reading for the exam preparation. As it is a family medicine exam, who are reading the textbook and which textbook, please, can you tell anyone, please? I hope minimum some of you are free to talk to me. Please interact now. Which textbook are you reading? If anyone appearing the exam, please, hello.
Sir Davidson?
Davidson medicine book. Okay.
Yes, sir.
It is for understanding purpose. It is a medicine book, is a design for the medicine specialist. But you are appearing the family medicine. So can you mention, can anyone mention any family medicine textbook?
Oxford Handbook of GP.
Yes, so it is not textbook, it is rather handbook. Anyway, a similar book, Oxford Handbook of General Practice. Any other book Dr. Nasir was talking?
Swanson.
So on, so on. Yes, many other book, many other book. But those who are appearing the exam now, only 3 months in hands. If you are busy with the textbook, you cannot manage the time. Textbook reading time is over one. Second, I'm not discouraging textbook reading, rather practical situation I'm dealing and I'm thinking of. And a textbook giving you the whole details of a disease. If we are, though your exam is not completely on disease only 100%, there may be some other technical things. But most of things are from disease oriented informations. So when you go through a topic, a disease in the textbook, it will be a very detailed discussion there, and you need to pay a lot of time there. For this reason, for exam purpose, textbook reading may not be always too much fruitful or too much practical. This is one. Now, go to the suggestion given by the Royal College Authority. It is almost copied as it is. They are telling your reference materials will be like that. Okay. The questions are derived from accredited and referenced sources, including review articles, original papers in journals, readily available to all GP family physicians, primarily from the Oxford Textbook of General Practice. I repeat the word Oxford Textbook of General Practice. They are advising. with clinical evidence material, British Medical Journal, British Journal of General Practice, especially those who will be practicing in the UK. But for the outside UK also, the basic principles will be same. World Health Organization and NICE guidelines. And for the drug-related information, British National Formulary. In addition, South Asian journals of relevance. These are the advice given by the Royal College. Again, I am asking, who is reading all the materials here? Anyone? Can anyone say? Or not reading at all? Not at all. You are not reading everything. Dr. Ashraf?
Sir, I try to read the NICE guideline
NICE guideline.
and having and Davidson only.
Maybe,
But
okay. It will be a good source for the medicine. Though Davidson Medicine is not a book for the family physician.
but
But
sir,
Davidson will serve the purpose for many other reasons, understanding of disease and other many things. But
sir,
you
general,
see that they advise many things to be studied, right? British National Formulary for the drug, journals. In real sense, in our real life, almost impossible to read everything. Okay, Dr. Ashraf,
yes, sir.
do you agree with this?
Sir, I have the GP practice book, but it is so many details. So,
Davidson also having so many details. Anyway, Davidson is not a GP book, remember it. I don't
okay,
know
sir.
what other colleagues are doing. For this reason, the popular things are the learning materials by different authorities. Okay, I think all of you know it. The for MRCGP, MRCP, or other competitive exam in the world, there are many sources are there. One of the very common and popular is the past medicine. There are some other sources as well, past test or on examination.com. But till now, primarily we prefer and everybody prefer the past medicine, pastmedicine.com sources. Most of you possibly you are having it. So when we go through the past medicine content or any other sources, you will get almost everything from there. So this is the way, this is the technique of preparation, but nothing is 100%. So we need to know how to read the past medicine material also. Isn't that it, Dr. Asha?
Yes, sir.
Right. But regarding the desire of textbook reading or an authorized reference sources, definitely a textbook. But in our experience, to manage our time, we advise always these one, Oxford Handbook of General Practice, not the textbook. In real life, we suggest Oxford Handbook of General Practice. Those who has gone through this book, you will understand the content of these. This is not like medicine, Davidson's medicine or other book. The very, very practical action plans are there. And this is helpful not only for the exam, rather in our practice as well. So this will be your overall learning materials for your exam. Now, how to start with, right? How to get started our topic today. We have to prioritize that which system we need to learn first. There may be some new topics also. Those who are reading only Davidson medicine, you may need to start some new topic for GP preparation. So you can select this. Again, selection doesn't mean only the new topic. Rather, the importance of the topic in the exam. This is also important. So how to design, how to understand the importance in the exam? Number of the questions. Suppose you will be given 200 questions. So from there, the topic you are selecting how many questions expected to appear from that system. It is also important. So in general, the clinical medicine headlines are very important. Suppose cardiology, respirology, like that. This is the one common way of selecting priority. Another, I already told that if you are poor in some topic, you can start with this. To learn a little hard thing, to give a more time in initial part of your preparation. Anyway, so if you select the system, you see what we do in our real life, in our institutional learning. We go through the textbook, we attend the lectures, go to the word, get some hands-on learning, many other things. But for AKT exam, as hands-on, that means the practical part is not important. So no need to go to actually practice many things in the word or the indoor, rather to say. But the informations or knowledge you have gathered in your training life, academic life, it is important also for good performance in the exam. Even the exam is a written exam. But we advise that you attend a discussion class, or discussion class is available anywhere. There may be free discussion class, there may be paid discussion class, which will be the suitable for you. You can attend there. Or you can make initially a discussion group also as well. But what we have done for that, we are telling in this way, you may attend interactive live lecture session, or you may go through recorded interactive sessions as well, which is becoming more popular nowadays. The recorded learning material. The reason is that you can study this, you can view this, you can listen it anytime, anywhere. So this is just lecture. The reason is that you need to note down your required topics. Required topics means the lecturer will tell you for your exam, suppose for AKT exam, the highlighted materials, which topics will be important from this system. Otherwise, if you again go back to tell that I will try to study the textbook, so you started from the A up to Z, but from A to Z, everything is not important for your exam. So I believe that those who are mentoring the programs, the speaker or lecturer can guide you to make a plan of the topics which will be required for your AKT exam. So this is the especially the first step, rather to say. And then after noting down, you go to your question bundles. Question bundle means suppose we are advocating the past medicine materials. So I hope all of you have the question bundle from the past medicine. Maybe you might have additional material also, whatever. How to organize the materials. Suppose all are the topics. These started alphabetically A to Z. Suppose angiotensin converting enzyme, inhibitors related topics are there. We have selected a cardiology topic, for example, from here. The many questions means these are, you know how to read it. The question related discussion is there. Suppose you like to start with hypertension, for example. How to start with this learning material? You need to have the learning materials better to be organized in this way so that you can click and open the file. I don't know how many of you having the material in this way. So if you like to study the hypertension, you see in the third column, a list of hypertension. Just follow me, please. So these are the topics discussed here. Now, in the hypertension, for any other disease, like other disease, there may be diagnostic question, there may be management question, there may be investigation related, there may be some other issues. But common thing to study a disease, we need to know a presentation, clinical presentation, then investigation planning and the management. These are three broad headlines. So you need to read these learning material. And when you match with your previous lecture classes, that means the video lecture, whatever you say, definitely you will get a correlation of the content here. You may get something more also. The lecture viewing would be a guidance for you. Lecture will not give you the whole details of hypertension. For this reason, the whole details, the topics relevant in the exam be discussed in the learning materials. So you go through one by one. Okay. So how will you go through? I hope I will discuss it a little later. How will you go through these learning materials? Anyway, so after reading these, you will have an idea of hypertension. Okay. Then I'm just going a little back. I'm not telling that after reading the hypertension, then go for the exam or mock. Definitely, you finished everything in this way: hypertension, atrial fibrillation, angina pectoris. Another thing also I like to say, if you want to read ischemic heart disease, so angina pectoris is one thing, another is myocardial infarction. But see, alphabetically arranged angina is here, myocardial will be in the M. So M is a later part. So you need to read angina pectoris and followed by myocardial infarction. I think you understood very simply. So after reading your learning material, so first of all, our suggestion, you finish your past medicine. And those who are really appearing the coming exam, your time is very short. So be tactful to proceed further. And how to read SBA, we have a YouTube link, a little more discussions are there. But for today's purpose, I am selecting one case like this. I like to repeat the word how to study SBA. So let me read for you. 67-year-old male presents with dyspepsia, which started about 2 months ago. He thinks he has lost some weight. On examination, he looks a little pale and has some angular stomatitis. Most appropriate management strategy. So when you come across this question, your learning material has something else also. Okay. I will show you in the next slide. But before looking at the answer option, you need to think of, as a clinician, as a physician, as a doctor, that in this background, what you will do. Can anyone respond, please, to answer this? Please. Who can? If I ask from down, Dr. Rizwan. Dr. Rizwan.
Yes, Assalamu alaikum.
Welcome, salam. Can you answer this? Don't mind, it might be wrong. No worry.
Yeah, actually, there's a red flag that he has weight loss. Some weight loss is there, and this one angular stomatitis. So there's,
You just straightforward tell your answer. Okay, we will discuss a little also, no problem.
basic labs, sir, I will go for the basic investigations like
So you mentioned the name of the lab.
CBC. I will go for that,
CBC.
and yeah, and stool
Okay.
DR as well.
But you need to choose only one modality of the test. You are thinking lab test.
Lab
Not
test, then I'll
okay.
go CBC.
There may be, you are thinking that management means investigation, right? Somebody will
Initial,
think that
yeah.
somebody will think that management means here most appropriate will be intervention. Somebody will
Intervention.
tell that the procedures. This is also one of the investigation like endoscopy. Okay, so you are thinking that you will go through for lab test like CBC. Thanking
Yes.
you.
Yes, sir.
Thanking you. Thanking you. Other colleague, please. Any other option? Is a very crucial part of the learning in this way. Dr.
Urgent
Nasir,
referral,
referral to where?
gastroenterologist for
Gastroenterologist.
urgent
Okay.
endoscopy.
Okay. Oh, for endoscopy or referring. Dr. Rafia, possibly open the mic. What you will think? Sorry? Can you open the mic again? Yeah. What do you like to?
Endoscopy.
Endoscopy, same. But somebody might think to give PPI because patient presented with dyspepsia. Okay. For 2 months. So many options could be possible. And your strategy is which will be the best option. Okay. Now look at the options given. Sorry. Before giving your answer, the Dr. Rizwan started nicely that Dr. Rizwan identified some keywords. Keyword. For example, some red flags Dr. Rizwan mentioned. So what are the keywords in this case? In our sense, a patient presented with dyspepsia, age will be keyword, weight loss will be keyword, patient is pale will be keyword, presence of angular stomatitis will be keyword. Considering these things, again, the duration also important, no doubt. So they are asking about the management. So nicely, some of you told your opinion, personal opinion. Possibly you are doing in your chamber like that. All might be correct. So considering these keyword, then look at the options. Now you match with the option what you discussed.
C.
Now refresh your answer. So Dr. Nasir possibly said endoscopy, right?
Yes, sir.
Okay, so this option is there. That means your option, I'm telling correct. I'm not telling the best. We will tell the best later on. But this is the correct option in the management strategy. Okay. And other colleague, can you share what could be the best option? Suppose someone said that the Dr. Rizwan possibly said the CBC blood test. So blood test option actually might be there if it is a test for the Helicobacter pylori. Though
Answer
they
C.
didn't mention the blood. Dr. Ashraf, what? C.
D.
D. Proton pump inhibitor and 4 to 6 weeks. Then you will see the patient again. It might be a strategy. Might be a strategy, right? Can other colleagues say? Doctor, if you don't be interactive in this way, your learning will not be fruitful, doctor. It is your chance to interact today. Dr. Homa possibly telling what
Yes, Assalamu alaikum.
what you will think from there.
I would go for C
See.
because of the risk factors considering his age.
Okay, thank
and
you.
weight
No need
loss.
to explain. Okay, no need to explain. I will ask you explanation later. Somebody maybe chest X-ray, I don't know why. Very less important possibly thinking here. What I like to say, when you get your learning material, you will get the material in this way. Just simply in this way. But when you go through learning material, my suggestion is I am going back in this way. This means you just read up to the question and think by yourself and identify the key materials, key informations, and then look at the option. And from there, you select your answer and go to the correct answer. This is the single best answer strategy. This will be the best way of learning, not directly starting from here up to there. It will be like a newspaper reading. So style of newspaper reading will not be inbuilt more. If we discuss this question, actually what you said nicely, we have to consider some alarm features. So this A, L, A like that. You can see in the right bottom part, the alarms 55O. This is our mnemonic we developed, getting the help from the book. So considering this thing, we are getting some alarm features. If alarm features are there, so upper GI endoscopy will be the best option here. After this, you will go through this discussion. Definitely you will get in the learning materials the text related with the question. It will give you a wider informations. So we are not reading here for this. So this is one of the example how to study single best answer in your learning material. Okay. So again, you can see a little more technical types of the question as well, and the discussion in our YouTube videos. Possibly all of you know our YouTube, DOAMS PD. Yeah, you can get the link also on request if you don't know. Okay. Now, the important guidelines for the exam. There are many guidelines. Dr. Ashraf said, Dr. Ashraf is reading nice guidelines. Yes, for the exam purpose, nice guideline to be followed. No other guideline. This is suggested by the Royal College. Okay. But thing is that, should we read whole guidelines? Dr. Ashraf, did you go through a guideline of any disease in the meantime? Dr. Ashraf?
So if I have time,
No, I'm not telling. Did you go through already in the meantime any disease, nice guidelines? Suppose hypertension, diabetes.
yes, sir, already.
Okay. If I ask you how many days you spend to read hypertension?
Uh,
Is it 1 hour or 1
yes,
day or 1
yes,
week?
yes, sir.
How many?
1 hour or 2 hours.
1 hour, 2 hour may not be enough. If
Yes,
you
sir.
read the piecemeal, it can be. But if you start the whole guideline in our real busy life, it may take few days also. Okay. So anyway, so my suggestion is, if you have time, suppose if any of you is not appearing in the coming exam, for your better interest, you can go through. But actually, all the things available in the guideline not needed to be studied. So what to be studied? Again, you think back, especially your learning bundle. Question bundle would tell you what you need to be studied. Actually, all the materials relevant given in the learning material. Suppose past medicine material or past test material. When we will go for the guideline reading, if the learning material discussion is not very clear to you, you are very enthusiastic that no, I need to see definitely directly something from the guideline. You just open the topic and open the guideline. Not like whole details. There may be many other technical informations. Almost 50%, I think, more around, not relevant for your exam. There may be some technical discussion of other issues. Okay. So guideline will be very selective, or textbook also likewise. Important paragraph, go for the textbook or the journals. So these are not, I'm telling that totally completely ignorable. There are some importance. Considering the importance of the time in our hand, we have to be very technical or tactical. So if you have time. But now, for the coming exam, actually not enough time you are having in your hand. Again, some of you might have time if you are almost prepared for your exam also. For your interest extension, you can go through a little. So this is the guideline reading another. Now, next. After reading everything, especially the learning materials, there may be some notes and others also. I will discuss also later on. A practical demonstration, I will show you our device. So note down your queries. Queries means confusion topics. So this is noting down the second time. Okay. When? after appearing your system mock. And the system mock definitely not looking only the score. You need to see the explanation as well, like the learning material reading, okay, explanation. And from there also, practically you will not score 100%. Rarely you will get 100% mark from system. But our target also not 100% attainment or achievement. More than 80% enough. Definitely will pass, we can say. For this reason, some topics may be confusing, puzzling. You need to study further. So again, you make some notes from there. That means you should have a manual rather book, hard book with you. You are writing that. Okay, so now how to solve this thing, everything. You understand that initially you made a plan, the topics you will read. Now after reading primary, then you appeared the mock exam, system mock. After that, there is something remain to be studied. Definitely these material topics will be a little harder for you, a complicated one. If you are alone, nobody there, you must go through by yourself. But nowadays, the world is your hand by the online connection, connectivity. You have your friends and colleagues throughout the world. For this reason, better reading will be a group discussion. This is our opportunity from this, what I say, the DOAMS, that to say, these address, and I don't know, I believe that all of you today here connected all the time, we are sharing it. Incidentally, if anyone not connected, you can join the group. Okay. So this group, one of the example, you may join with many other groups, but you need to select also groups which will be fruitful for you. It is also, you understand by yourself what I mean. So in the group, you can throw your question. And there might be maybe other colleague who can share, interact with you. There may be one way. So if you have friends surrounding in your area also, you can sit together, have a cup of tea or discuss each other. It will be very good if possible. So this is the second steps of solving your queries. Okay. So up to this, you finish your system mock. That means your prioritized system you finished. Definitely you will go to the next system. So up to this, I believe you understood how to read the learning materials. Okay. Now, the topic here a little about how to attempt the mock question. Already I have told about the system mock before a little. So how to appear the mock, that system mock or complete mock. As it is what you are learning traditionally. Directly a question in front of you and you are giving the answer here. So can anyone be volunteer again? I don't know who will be feeling better. Dr. Harshani. Dr. Harshani, if I'm not wrong to utter your gentle name, good name. Can you talk? Can you read? Just asking you, or Dr. Iram or someone here, that how you go through this question in the mock exam. Dr. Ashraf, open the mic, please. You tell me how you give the mock exam.
Yeah, read, sir.
That means you read from here, right? Sorry,
Yes, sir.
sorry. A58 here up to this, then you are coming to the what is the best next step, then you are thinking and choosing your option, right? Is not it, Dr. Ashraf?
Yes, sir.
Yeah, right. So it may be a very traditional one also. It may be one of the way of reading this. But there may be some other way also. Suppose you select the topic usually given in the first sentence in the exam. Sometime the topic will be clear. Suppose in this case, the topic is the blood pressure related topic. Okay. What is the question? What is the best next step? Maybe investigation, maybe clinical exam, maybe treatment, like that. Somebody say, you start from the option first. Have you heard it, Dr. Ashraf, or anyone? That you look at the options. Option means A, B, C, D, E. These are options.
No, sir. I didn't know.
Somebody say, and then go back to the scenario. I'm telling some technical points. If you think in such question, if you start from the options are long enough, you cannot remember the options. But if the informations are very simple, you may remember also. Why looking at the option is important? Because I need to answer a question in the exam within limited time. So if you keep something in the options, or 5 or 4 options are there, then go to the scenario. Then from reading the scenario, you will synthesize one after another the best answer. In this technical way, looking to the option may be another technique or answering the question. But in such design of the question or the options, it may be a little difficult because options are longer. Is not it, Dr. Nasir, Dr. Ashraf? Those who are talking, I am just calling you. Okay. So in such cases, the traditional way you can follow. From there, minimum look at the headlines and go through one by one. Okay. So to attempt the best answer, the technique is as before. Look at the keywords and choose your answer. So who will give the answer now here? You will learn one topic also today. Anyone to give the answer?
B.
B.
B, sir.
Ambulatory blood pressure monitoring. So let's see. Before giving the answer, Dr. Possibly Nasir is memorizing this chart algorithm. If blood pressure so and so, what we'll do? Might be answer is there. Offer ABPM. Okay. So you are right. You are right. So before giving the answer, we are utilizing our knowledge. Okay. So this is one of the way of giving the answer. Now come to the another scenario. Again, mock question, right? You have to see directly to the question, not as study the SBA before, without option. Directly, there are some options. In such questions, you can look at the option first. Okay. So, Dr. Ashraf, what are the options given? Can you read?
Sir,
Quickly. Mock question should be read very quickly. Carotid, duplex.
Carotid duplex CT scan and echo, first lipid profile, MRI. Brain.
That means actually you have to read not MRI brain, you have to read MRI. We have to see carotid duplex, CT, echo, fasting lipid, MRI. In this way, rapid. Okay. Not that every word I have to read, because I know what is this. I am looking, I am reading. So keeping in this mind, there are some investigations. Isn't it? So if you now go back, Dr. Ashraf, 60-year, can you read from there, a 60-year-old woman?
Suffered 3 episodes of transient right molecular blindness.
Okay.
Her heart rate is 88 beats per minute regular, and she is in sinus rhythm. What is the single most appropriate investigation that would diagnose the conditions?
Right. So already the options in your mind. From reading, in between also you can select your answer. Sometime this way of reading the question for in the mock exam will be fruitful. Understand, Dr. Ashraf?
Yes, sir.
Especially if the options are 1 or 2 words like that. So now what will be the answer here? Again, we will go for the keywords. Okay. You see, look at when you go through after reading the option, when you go through, I hope these keywords will attract you. Keeping this in your mind, single most appropriate investigation. Now, what will be the answer here? Can anybody give the answer?
MRI, sir.
Which one?
MRI.
MRI of the brain. Okay. Can any other colleague can join?
So a carotid duplex.
Carotid duplex. Any other option? Silence sometimes mean inactivity. Sorry to say. So Dr. Rizwan, possibly you answered carotid, not MRI.
Yes, sir.
Why not MRI? Why you have chosen carotid duplex?
So straight away, I think we should not go for MRI. First, I mean, because the pathology is, says monoocular, blindness. So most probably due to the carotid artery, the problem, atherosclerosis of that.
Ischemic insult, you are thinking,
Yeah.
right?
Yeah,
Ischemic
thinking
insult.
about
MRI will
Yes, sir.
give the effect, but the disease source, can we do anything? Suppose if it is already transient right monocular blind, it is a gone case, right? Like TIA, transient ischemic attack.
Oh.
It is actually ocular or visual TIA, rather to say. Maybe ischemic insult happens, 60-year-old patient. As it is an ocular problem, the source of the ocular infarction, ocular means retinal artery or its branch infarction, the source will be carotid artery. So we need to identify carotid artery situation. Maybe Dr. Rizwan thinking as such. What I understand. Is it, Dr. Rizwan?
Yes, sir, of course.
So keeping these keywords and your answer is right. But traditionally what we do, any stroke and other, we go for the imaging at the affected area. Okay. So without reading the learning material, how can we actually learn? All are correct. All are correct almost, more or less. So this is the flavor of single based answer. Now, like Dr. Ashraf today, that why MRI is not be the best one. You need explanation. So explanation is here. Okay. In short, maybe detailed discussion. Already you have this material. So I have shown actually the technique of giving the mock exam. Again, after the mock, okay, you have these queries and others, whatever you think, one by one, come to the group discussion. Okay. Then your learning will be completed and you are at the end of your preparation time, having few days in your hand, appearing the exam. Okay. In few days, at the later part, suppose we prepare 2 complete mock. You may have more than that. Each mock containing 200 questions. So definitely it will take more than 3-hour time. You are preparing yourself to appear the mock exam, complete mock. The helpful guide will be there in this time now. Study the recall questions. You can see the recall question early also, no problem. My humble suggestion as a mentor, with our experience, I am just suggesting. It is not hard and fast rule for you, but will be the fruitful that I am sharing. So you study the recall questions as much as possible. You may have recall of 2-year, 3-year question. Actually, these are not direct recall. These are the theme question, conceptual questions. After the recall question, it may be pictorials, it may be text-based. Then go for complete mock exam. And when you select the day of the mock, complete mock, keep in the mind that your attempt will be uninterrupted. Even the system mock also, though I didn't tell before. Uninterrupted means, suppose you are hurried to do something. In the meantime, you had started the complete mock. There are 200 questions. After 40, 50, you stop and went to the market or shopping or the office or some family issues. It will not be fruitful. Select the day and time so that you will be uninterrupted and complete the mock, submit it or see the answer discussion. This is the one. And usually few days before, if you have very short time, like 3 months time, maybe 1 or 2 days in your hand. So you can appear the mock at the 11th hour, but keep 1 or 2 days better before the exam date, spare. After the mock, you need to think something more also. For this reason, suppose 20th November your exam, if you appear the mock on the 19th, so you are not having time in between. So our suggestion is preferably you will appear the mock within or around 15 November, for example, in the coming exam, so that you can have 1 or 2 days time in your hand. Okay. And the day before the exam date, don't spend time with your specific topic. Think globally, generally, and try to get relaxed, which is very difficult most of the time, but it is found that if you get relaxed day before the exam day, your performance will be good. If you take good sleep, I think all of you know the technical thing throughout the life. Day before the exam, what you will do. So in this way, you will make yourself confident. Now, one technical thing I will not discuss again, just to tell you, you don't know the answer at all. Some of you might attend our discussion before. This discussion also available in our YouTube. You can see. Without knowing the exact answer at all, how can select the answer? You may be right. That we discuss in the link. Again, on request, we can inbox you in your WhatsApp if you request to us. Blind answering, that we say blind answering by gazing only. There are some techniques of gazing. So this is the way of giving the answer. Now the time actually after the discussion around now from our side, your job is to organize your learning materials one after another, one after another. So our humble suggestion, already we put how to do it one after another now. Okay. So now raise your question. This is your time, 1 or 2 minutes. Now, any query in your mind, please feel free to ask any question regarding your preparation.
Sir, I have one question.
Please, please.
Yes, sir. Sir, is it better to make any short notes and do the MCQ topic wise? For example, if we read fast medicine, hypertension, and then do all the MCQs of hypertension. So by that way, it will decrease the time and grip of the topic. What you suggest, and also the learning material for which you provide in the package. So what is your thought?
Thanking doctor for asking. What you said, this is very traditional. I like to say old model to make a personal note. This is important, good, for better memorization and understanding. If you have enough time in your hand, because you are reading something, you are writing in another book related with the hypertension, you need to write a lot of things. To overcome these limitations, actually the learning materials are developed. If you want to highlight, suppose PDF, Dr. Nasir, be connected because you raised the issue, better to be connected to discuss. There are PDFs,
Yes, sir,
suppose you are having in your hand. There is every chance to mark the PDF, highlight the PDF. This is possible, right? Yellow or other color if possible. But something you are forgetting many often, you can write in a notebook. That means I like to suggest no need to write everything to make a personal notebook. It will be again a big one. You are purchasing the material from the online or from any sources, even from ours. What we have given to you, these are the learning materials given to you for your personal utilization. So why you will do again your job? So practically it is not, I think, not very fruitful thing to make a personal note in the context of time management, I like to say. So go through the learning material and make marking there, highlight there, and very little note you keep with you so that anywhere you can see. Somebody is very feeling not comfort much enough in the screen. So even screen reading is the laptop reading better or pad is better, not the mobile phone. Mobile phone screen is very small. So if you are busy with the mobile phone all the time, in that alternative, you can make a hand note, it will be useful. But keep in the mind about your available time. Okay, Dr. Nasir. Hope you understood what I mean.
Yes, sir. So nice, sir.
Okay, any other Dr. Ashraf is there on to maybe.
Sir, if the question in the online, the exam center give me the question or the ID link, and if I answer the question, if any chance to previous check any can be check the previous question if
Usually it is possible. You can go back like real hard paper, pencil paper exam, like you can go back and change the answer also. Okay. Suppose if you go through our material we provided in the learning AKT module, this also designed as such. You can give the answer A, B, C, D, anything. Before submitting the form, again you go back. Okay, Dr. Ashraf?
and they give any hard paper or rough
No, no,
paper?
no. No hard paper, no paper. It is a totally online exam. Totally online exam.
Just mouse, nothing else.
Yes, yes.
Okay.
And it is said also that if you think of calculation, suppose a statistics related question, the Royal College said that there may be calculation as such, you don't need to write anything. Mentally you can do. Suppose 7 plus 5 is equal to 12. Like that arithmetic. Okay? No need to write anything.
So
Fine.
I just read, sir, your past medicine book,
Yes.
which was provided in the module.
Module, yeah.
And it's so huge. I just tried to cover it up.
So huge means there may be past medicine note one material, notes, another is a question bundle. This is a different thing. Which one you mean? Notes or question bundle?
Notes, then questions, all of it actually, but I need
Yeah,
to cover.
all of it seems to be a bigger one. Suppose if you think to start the study from today, you have only around 90 days time, not more than that, for example.
Yes, sir.
So it will be hard for you to read everything. Okay. The notes you will not read, for example. You will not read the notes. You will read only the question. And question contain also the notes there, some relevant notes. Understand? You ignore even the textbook you will not read. You will not read the notes, separate note, all topic wise notes. But you will read the question. Question related note at the lower part of your file available. You will go through only this. And you will find that suppose I don't know our colleagues listening me well or not. I have shown you hypertension related maybe 15 topics in the past medicine, 10 to 15, for example. But 10 to 15 file does not contain dissimilar topic. Almost identical materials are there, repeating the same thing. But question is different. They are discussing alternative answers and the rationality of the answers. But at the bottom, lower part, overall brief for the hypertension, how to diagnose, what will be the management guideline and the other. So these are very common. Understand, Dr. Ashraf?
Yes, sir.
Don't be afraid that learning material is too much. Actually, the things are repeated. Topics are repeated in multiple files. In the 15, maybe topic only 2 or 3, the complete topic. So it will not be very exhaustive. Don't be afraid.
Yes, sir.
Whenever you go through the heart failure, management of chronic heart failure, common to every file. You will click it and see it. But question is different. Scenario is different. This is the actually pleasure to read in this way, online reading. The
Yes, sir.
online material will be your partner, I like to say, for reading. Okay.
Sir, as you said, sometimes I feel bored and all time looking at the monitor. Sir,
Okay. Monitor
I
health, screen health, computer health is a different topic, right? So we have to use the glass better one, right? Why you are asking this? Though is practical. The okay, the ray protected glass, sometime a little costly. We have to use it. Ultraviolet light protective, refractile or something. It is said one. Second thing, rule is that 20-20-20. 20-minute reading and then 20-second off. Off means you will be out of screen, though practically not possible. And then look at the screen. It will be a bigger screen.
Yes.
Okay.
Okay.
Thank
Sir,
you.
one
Dr.
question
Nasir.
more, sir.
Yes.
Does your package contain only past medicine, or on examination is also there? I think it is there.
I will show you.
MCQ.
I will show you. I will show you the module to you. Don't worry. Package I will show you a little later. Whole thing I will show you. More than past medicine is there. Okay. Any other question from anyone?
I have a question, sir. MRCP or MRCGP, sir, in past medicine. Though we are following the MRCGP, so like hypertension, sir, in MRCGP have the same nice
Almost, yeah. Concept
almost
is
same.
same.
Concept.
Concept is same, but the exam required topic is different. That I mentioned today, that you need to listen the lectures. Then you will understand what your lecturer is telling about hypertension relevant for AKT, not for MRCP part 1. But I'm not telling absolute thing, not means you appear the specialist exam like MRCP, you need to learn something more than AKT about the hypertension. This is the thing. Okay. So in that sense, your learning material for hypertension, this is also important for MRCP, but flavor is different. I told A to Z, not always important for exam. There are some flavor of different exam. MRCP have some different attention in the hypertension, which is not relevant in AKT exam. Understand, Dr. Ashraf?
Yes, sir.
For this reason, we need to go through the learning material. Only reading the textbook is not enough. Clear now?
Okay, sir. Yes, sir. Clear.
Okay. Any other query from anyone? If not, I can switch.
Sir, sorry, one more question.
Rizwan, please. Okay, please. no
Sir,
worry, no worry, no worry.
Thank you very much. So regarding this child milestones, I mean, they're very difficult to remember. Developmental
Yeah,
milestones.
actually, it is difficult. It is difficult. But
so, what is your expert? I mean, advice for this?
My experience is that I was just facing the question and answer, and try to learn about the that age stages of the age. Suppose at the end of 1 year, at the end of 1.5 year, at the end of 2 year, not that at the end of 13 month, not at the end of 17th month. Understand?
Yes, sir.
This is the
So
milestone. This is one of the
I
way.
tried a lot actually, but very difficult to remember. The
Difficult.
intermixing actually.
For this reason, you need to read the question repeatedly, milestone related question repeatedly.
Yes, sir. It's
Repeatedly.
practice only.
Yeah. Though we provided some the picture, there is a chart tabulated form. Again, it needs to be remembered. But my advice not to remember chart is it will be very disgusting. Okay.
There's no
Very
particular
disgusting.
mnemonics or anything, sir.
Sorry, particular.
Mnemonics or anything particular
Sorry,
for
doctor, I couldn't try. I haven't seen anywhere that there is a mnemonic. But in our real experience, suppose, for example, if you're married and you're having the baby, you observed your baby, you can correlate your baby's age and his growth. But you have
I
seen
tried
that.
this, sir, again bit difficult, not accurate.
But
It's working, but
don't worry in a sense. Suppose milestone related question maybe 2 or 3. That's right. So as much as possible, you try your best. Don't spend a lot of time. This is also technique. For example, statistics questions. Only 2 or 3 questions you will face the statistics. Not much. But if you spend a lot of time, 1 week to 10 days for the statistics, you will be loser.
Yeah, exactly, sir.
This is
Any
the way.
distribution, sir? Any distribution, sir?
Actually, officially, they didn't have any specific distribution. But on an average, I have calculated the topic you have seen our lecture contain maybe 24 lecture under 20, around 20 plus headline around. In this way, each system have around 10 questions. Okay, big system, maybe 10 to 12, 13, but a small system will provide 2 or 3 questions on an average 10. Understand? If you divide the 20 topic, the question will be 200. Okay.
Sir. So on average 10.
On an average 10. But there may be some, for example, female health, women's health, male health. These are special topic in the family medicine. They may choose some question more than 10 question from there also. But it will not be 20 or 30. Few question maybe, but on an average, you calculate 10. If you go through our headline topics also, you can have some idea in the module on an average. And now I think if I tell you, as you are raising this question, by giving importance, our module will give you some guidance of that. So this will be our interactive module, and how to run the module, I like to show you now. Just give me few seconds to open it. Dr. Ashraf, can you see the module?
Yes, sir.
Okay. So other colleague, please be with us what I am telling to you. This is a PDF, but it is interactive. And those who are using, you know it. And those who didn't see before, be serious and sincere to see. Okay. So if you start with this is the first page and these are the contents. You see the system, okay? Cardiology, dyslipidemia, other. So Dr. Ashraf, you have seen already, and other colleague also, around 20 or plus minus topics are there. And each system or total things are 24 lectures, 22 system mocks with personalized feedback, maybe 21 or 22. Sorry, a little correction maybe there. 21 or 22 system mocks there. So around 20, I told you. That means we gathered and selected the small systems in one headline. And the recall is not only PDF. There is a live discussion record. Relevant books and other things are there. So how to start with? If you want to see the relevant books, you just click there. there, suppose I'm clicking. If you registered, you can see the learning materials in the online available, Oxford Handbook of General Practice and the past medicine notes. This is our preferred to go through with this. Okay. If you want, you can click there and open. But come to the system one by one. Suppose traditionally we start with the cardiology and we added a topic, dyslipidemia, including the ECG. So we allocated day 1 up to day 6. Look at the here, doctor, at the upper part. D1, 6 means day 1 up to day 6, 6 days, because you have to divide the 90 days around for this. But those who are not appearing, if you want to read it more, okay, you can make it double. So you have to use it for the 6 months time, for example. Those who are appearing the exam, so 1 to 6. And there will be lecture 1, cardiology lecture. So if you click there, view the lecture, we already told you, start with this. And this is the video. Just wait few seconds to be the video to be uploaded. So those who are using, don't mind, don't be what I say, irritated rather to say, I'm sorry, as you know it, but those who are new, it is for them. So if you click, so you started it. The lecture, you can listen it. Discussion is there. Maybe voice is not transmitting what I am talking. This is our lecture. Okay. Okay. So the participant are asking something, the question based and others, and you finish it. Okay. After finishing this, the first thing, view lecture. And come there also ECG related. There is 5 lectures, master classes. But again, you see the lecture ECG means only exam related few things are discussed there in the ECG. But if you want to enlighten yourself more in the ECG, and which is most of the time needed, you can click there one by one and you finish your ECG topics from there. Okay, so lecture ECG or others, it is related with the cardiology. For that we have added it. Now see the relevant slide. Only a little advanced for advanced learning. There are some PDF slide. Again, it is in the online. Okay, like that, one by one. Many other things, box and others, pictures, tables. It should be very hurriedly as your exam is ahead. After finishing these, it will take half an hour or 2 hours, like that, if you be busy more with the PDF. After this, you come down to the solve question bank. This is the main thing for you. So as you asked about the how many question bank, Dr. Nasir asking, maybe, or Rizwan, someone asking about the question bank. We designed 2 question bank. The question bank 1, question bank 2, and this is optional. So this is the actually the past medicine. If you click there, past medicine cardiology will open here. Okay, they are adding more question. So this is first one question they started with. Then you see this is the question, this is the options, and this is the answer. We are trying our best to update it also in a palatable way more, but it may take a little more time, no doubt. So answer that and the next question 2, like that. So you finish it. For example, you finish question bank. Those who are appearing after the 3 months later on, for your extended desire, you can open the optional question, right? It is not really from the past medicine. This is from other sources, mostly on exam or past state, whatever you say. These are some related cardiology questions. So those who are appearing, I am not advising that busy with the optional material here, but our module contain, no doubt. I think you got your answer who asked the question. So after reading the learning material, now come to this system mock, cardiology mock. Okay. And then make the query and others. Okay. If you click here and it will guide, it will direct you to our WhatsApp group. For example, if you are the member, registered WhatsApp group, you allow this. And the join chat. Okay. Open the WhatsApp. This is the WhatsApp page already you have seen. DOAMS MRCGP AKT. Most of you possibly the member there, right? So this is our common WhatsApp group. If you link there. Now I come to show you the different color combination to give you contrast effect, soothing effect, that you will not be puzzled with the same color. For that, this is cardiology, this is respirology. So in every system, there is alternative color. The similar thing, but the learning material is 1 and 2 most of the time. In the respiratory medicine, there is no master classes relevant till now. We are thinking we didn't add a lot of things to make the learning module very heavy. You will be afraid of. Okay. The thoughtful additions are there. Those who are relevant for exam preparation, only these things are added. And if you again finish the lecture and other, I like to show you, for example, a respirology mock, how to appear. Please follow me. Suppose this is the mock button. Please follow me. In the mock button, you will register your the mock with the Gmail ID. Suppose our Gmail ID doamsbd@gmail.com. doamsbd@gmail.com. So now we register with this Gmail ID. Now you see each question contain 1 point. But your mobile phone or tab or the laptop screen size, suppose now it is very smaller. How to improve it? So in the mobile phone, usually by touch, you can enlarge it. But in the laptop, may not be touch system is there. So in the corner, you see in the button, action button. So you increase this by zoom in. Okay, here. And look at, so this is bigger now. So you are appearing the mock, you have select your answer. Suppose your answer may be A. So click here A, finish. Okay, then go down. One by one, I'm just going down. For example, last question. Maybe, yes, 79. Okay, this may be A. So we have given 2 answers. To make it complete, now you submit it. Okay, and there is no restriction like exam. If you skip any question, you will be loser. Nobody will tell you that, doctor, come back and complete the form. It is like the real exam. So you need to be very careful that each and every question you answered here. Remember it. And so don't skip any question. Okay, if you have time, you repeat from beginning, check your answer box, no doubt, but don't keep any question blank. So finally, you answered it, all 79 questions, then you submit. Like DOAMS BD is registered here, DOAMS BD is submitting this. After submission, so your response has been recorded. Now look at the score, for example. So you see, your question was 79. Okay. I didn't give the answer all of the questions, whatever, but your question was 79 number and you score 1. You can remember that I answered 1A, it was wrong. So this is a cross. You didn't get any mark there. And others already, you see, number 2 also cross because you didn't attempt at all. So you're not getting marks. Okay. Now come down in the last, as I attempted the last one, just to show you 79. You see 79 here is correct. So this is the green color. If it is correct, you score it and you see this is the green color mark given by the system. So 1 by 1, you got 1 over 79 question. So you don't need to see the explanation why you have gotten wrong. But if you come to the number 1, as you have done wrong, definitely will be curious to see. So a link is attached here. You see the correct answer is C, but you have given the answer A. So why this is C? Just click the PDF. Actually, it is a PDF of the description. I'm clicking here and the PDF is open. Is a whole PDF actually there. And now come to the number 1. You see, this is the correct answer C, but you have given, or I have given answer A. Okay. If you want to see each and every one, you can see from there also. But to save the time, if you given the correct answer, no need to see the correct answer. Those which answers are wrong, you just look at. And in every questions, every question and answer, there is a link. Whenever you need, you can open the link and see the answer. But with the correct answer, link is not there. This is the fact. But the link is common and all answers are there. So you can assess yourself how much you are prepared with the system. I think it is clear. Dr. Ashraf and other colleague, have you followed me?
Yes, sir.
So your system mock is finished. Okay. Now the technical thing. If you want to, this is a mock. I told you whenever you are appearing the mock, think that you are appearing the real exam. Don't be interrupted. For this reason, suppose if I click again as a user, what is shown, Dr. Ashraf? You have already responded. That means you cannot the file or form again. You can see the score as actually a score, but you cannot open the question paper. That means second time attempt is not possible. Okay. So in this way, if you appear the system one by one, so I think I'm finishing. Each system you see another color and the day 10 up to 13. That means 4 days are only allocated for the gastroenterology. It may be plus minus up to your deficiency. So at the end, there are 1 or 2 topics separately for clinical pictures and others. There is a no mock exam in the clinical picture, only discussion. This one, clinical picture X-ray. It is additional discussions are there. There is no mock exam. Now come to the complete mock. Before the complete mock, view the recall question and answer with discussion. These are also again the video you see. I am clicking there. It is not only PDF. So there are a list of recalls are there. 1, 2, 3, 4, 5, 6. The files, video. I'm just opening for you only to show. Click there, whatever you want, one by one. So this is the video. Is a coming. So those who attended the recall session, I think you can remember. You can remember. Okay. So if you finish this thing, all the videos, and after recall finishing, you come to the complete mock. Again, I am clicking the mock 1. Again, give your email here, and at the end you submit the down. After 200 questions, you submit, and it will give you the feedback automatically. Okay, so complete mock 1 and complete mock 2. And it will be finished, and we will be waiting to congratulate you after your exam by the mercy of Almighty. So this is a complete package really from us, and we tried our best, and day by day it is being improved. Any extra learning material will be relevant here. We are thinking and we are adding there, we are modifying there, and every day. And whenever those who are using the module, and you see actually recently also we have updated something. Those who are using, we have a group in the WhatsApp. We are informing them in the group, and we are providing the updated material. There will be no technical problem. if we update and give you the updated material, the link will be the same. And with your Gmail ID, what you are using, you can utilize it as before. No worry. But whenever we declare the updated material, you inform us or give a message to us that you need the updated material. It will be useful for you. Okay. So up to this is the module. If any further query of the module from you, please. Dr. Ashraf and others as well. Nothing more.
So, so inside the link, all are the same, right? Which was previously provided us.
Yes, yes. Previous and now, but we added some button extra in the latest one. In this month, I don't know, did you collect or not?
Sir, I didn't.
If you didn't collect, we provide you also. The same thing will be there. Only just modification, a little correction is done, very little. Okay. We can provide you, and any other, those who are using, those is still registered with us, you can inbox us. We will provide you this thing. Okay. So this is the module, and I hope it will be useful for you. It's very interactive one. And now come to the again, just to the thanking slide. And after this interactive module, this is our YouTube videos. Many topics are there already. We discussed in between. And this is our WhatsApp group and others, our WhatsApp number as well. And this is for till now our plan to provide you. This is a 21 system mock. Sorry, that was a little wrongly written. It is not 22 system mock. This is 21 system mock. 970 question plus and a full mock to 400 question. There are 24 discussion class. Masterclass in addition, already ECG, X-ray, other things, contraceptions, others. So this is our plan, subscription plan and other, doctor. I hope all the things are clear to you. And I believe you will be a very good performer. Okay. So if no more there to ask, we hope to finish now. Thank you very much to be with us today, and hope the best for you. Be in touch. Be in touch. Always be connected. Those who are still using the AKT module, whenever you have the question, you write down, note down, so that in any other session we declare, you can ask there, like this today or any other day. We will be with you by the mercy of Almighty, regularly connected to guide you until your exam. So those who are interested, please be connected with us as early as possible, because time is very short. Only 3 months time. You need to utilize it very technically, very useful time you need to pass. All the best. Thank you very much. Thank you again.